see the algorithm of management with a patient that comes with a breast lesion or a breast mass. So we have the algorithm for suspicious lesion and non-suspicious lesion. The algorithm for the suspicion lesion is first, what are the criteria? That is, if the patient is greater than 35 years of age, if has a family history, if the mass feels firm and rigid, if we see changes on the skin, and if we have lymphadenopathy. This is a suspicious mass for breast cancer. So here we will do a mammography, and depending on which things we see, and maybe we could ask for some other study, like the biopsies. In biopsy we are talking about a core needle biopsy or a excisional biopsy. Then after this we will see if it is ductal carcinoma in situ or if it is just a benign lesion. If it's a benign lesion, we use reassurance, and here we will treat it appropriately. The benign lesion, we have seen this on other videos, and we know that ones of them we need to treat them. For example, the atypical hyperplasia. In a sense, you could say that it is benign, but it increases the risk of breast cancer, so you could say that it's malignant. Anyway, the treatment, for example, for the ductal hyperplasia would be tamoxifen in premenopausal women and inhibitors of the aromatase in the postmenopausal woman. Alright, now the complicated one is the non-suspicious mass. So, non-suspicious mass, we're talking about a patient that is under the age of 35 years of age, has no family history, the mass is fluctuant and movable. The patient has or reports that the mass changes in size depending on this part of the cycle, of the menstrual cycle. So when it's coming, the menstruation, because we have increased estrogens, then increases in size because it's estrogen sensitive. For example, the fibroadenoma. So changes in size with the menstrual cycle. These are non-suspicious masses. So the first step would be to do a mammography. Let me erase this. So the first step would be a mammography. Then, or usually in the mammography, we suspect this, so we will do just a final needle aspiration, and maybe before this a ultrasound, because ultrasound is very good in distinguish a solid component from a cystic component. So here, depending if we have a solid or cystic mass. If it is solid, then we go to cytology in order to see if it is malignant or benign or inconclusive. If it is benign or inconclusive, we need to repeat the final needle aspiration or do a excisional biopsy. If it is malignant, we just treat it appropriately, but we will see this later on. Now, if we have a cystic lesion, then we have various options. Remember, when we talk about the cyst, we can have a simple cyst that when we do the final needle aspiration, this disappears. We can have aspiration of a bloody fluid from the cyst, bloody fluid. Or we can have like a residual mass. So if it disappears, it's probably going to be a simple cyst and there is not much that we need to do, so just reassurance and follow up in 3 months or 4 to 6 weeks in order to see if there is a reaccumulation of fluid, in which case, if that's the case, we can aspirate again. For bloody fluid aspiration or a residual mass, we usually perform a excisional biopsy because we want to be sure that we are not leaving any abnormal tissue there. So now, what are the indications of a excisional biopsy? That is, in a residual mass, in a bloody fluid aspiration from a cyst, if the patient has with bloody nipple discharge, if we cannot perform the needle core needle biopsy, or if we have some changes on the breast skin, like erythema, inflammation, something that suggests inflammatory carcinoma of the breast. So this is the algorithm. Yes, for the malignant, for this suspicion lesion, but most importantly, because it's more complicated, the non-suspicious lesion. So first ultrasound, final needle aspiration will distinguish a solid versus a cystic component. For the solid, then we will do cytology, and for the cystic, we will, depending on what the final needle aspiration also said, if it disappears, if it has bloody fluid discharge, or if it's the residual mass.